right, Dr. Kris Barnes, CEO of Lento Bio. Him and his team are developing therapeutic therapies to slow and reverse age-related vision decline. His work highlights how longevity isn't just about adding years, but maintaining quality of life. Take it away.
Thanks, Brenda. Hey, everyone. Really excited to tell you about what we're doing at Lento Bio today. So I'm Kris. So I founded Lento Bio because I really believe in the idea of the damage theory of aging, that targeting specific types of damage in tissues and in specific indications is a good way to really fight aging and advance the field. So what I want to do is basically I finished my PhD and did competitive intelligence consulting. At what point I kind of got to see in the biotech space what a lot of people were doing in different indications, and I saw a really big potential in presbyopia specifically. So that's age-related loss of near vision. And I'm going to tell you why I think that is basically a great indication to target, and why specifically, we've been started in 2022 and have gone from idea stage to having an asset we're advancing towards clinical trials. So I'm going to tell you about that. So basically, we are a company based out of Syracuse, New York. We work with Icor Life Sciences, and we specifically have basically developed a drug to reduce lens stiffness in presbyopia. So we effectively reduce about 2/3 of lens stiffness in aging in mice. So I'll show you those results. Also, specifically, we are currently fundraising, and we are working towards what we hope to be a clinical trial around 2027 in IND-enabling studies now. So presbyopia. Presbyopia is a disorder that effectively everyone gets around age 40, 45 or so, though most people don't know the actual name. You'll probably would recognize a picture of someone wearing reading glasses. That's basically what happens when the lens of your eye gets stiff and you're unable to resolve close images and you lose your near vision. So you get this kind of blurriness when you're looking at things close up. So presbyopia is a huge market, $18.2 billion estimated between 7 countries, and that's because, like I said, it's ubiquitous. Essentially, everyone's going to get it. Basically, I think durable reversal would be something which is really strong. It would make a big difference to a lot of people in the sense that this is such a ubiquitous and early onset aging disease. And specifically, I think an interesting aspect about presbyopia, and this was kind of what originally pulled me into this space, presbyopia is occurring in the lens of the eye. So the lens of your eye is actually really interesting because it lacks nuclei, it lacks mitochondria, it lacks a lot of the things that normally serve as basically redundant factors in aging. So it's basically the vast majority of the volume of the lens is structural protein that never turns over. So this is interesting because we are essentially dealing with one aging hallmark that we really need to reverse, which is this type of structural protein, extracellular structural protein stiffening. So our goal was essentially to create a drug, a small molecule eye drop drug, which is going to actually reverse the stiffening of the lens. And thus, it's a pretty straightforward move from phenotype to the actual disorder in this perspective. Another important aspect is there are actually a number of other companies working on drugs for presbyopia, but they're all short-acting, and none of them actually target aging damage, which I think is going to be by far the best approach in this case. So we started via actually just taking a number of drugs which are generally regarded as safe and testing them on the phenotype specifically. So what reduces lens stiffness? We targeted glycation inhibitors, targeted a number of things, but what we found specifically was a disulfide-reducing compound, a protective thiol known as N-acetylcysteine, which a number of people may have heard of, was the most effective by a pretty significant amount at reducing 8-month-old mouse lens stiffness. So from there, we worked basically to A, figure out how it's acting, and B, to optimize the lead and create an even better compound. So what we ended up getting, first of all, we believe that this compound is acting via basically serving a similar function to what glutathione normally is in the lens. So as I mentioned, lens protein never turns over, and thus it's, you have to have something kind of continuously pulled into the lens to keep it high quality, keep it from degrading and cross-linking. So that is glutathione, more than anything, in your eye, which is a protective thiol. But when you hit around age 40, really acutely, glutathione levels drop, and then that's a main cause of presbyopia. So, and then basically you have these disulfide crosslinks, a lesser known but equally important, I would say, kind of crosslink compared to some of the other more well-known ones like glycation in aging, which are forming between different crystallines and causing these types of aggregates. This is also something which is specifically targeting those aggregates, targeting that form of aging damage, and reversing it. So first of all, actually, I should mention one thing. So basically, when we went from N-acetylcysteine to continuing this assay for lead optimization, finding something even better, which is our current lead compound, LB01, also a cysteine derivative. So how is this acting? First of all, basically, LB01 needs to be very good at getting into the tissue it needs to get into, which is the lens, right? So we found that compared to N-acetylcysteine, it's actually 11x better in getting into the lens. It's not an easy technical challenge. The cornea has basically evolved for 500 million years to keep stuff out of your eye. So you got to get through that. You got to get into the very deep, dense lens. So we're doing that effectively. Additionally, in terms of actually on-target effect, disulfide targeting, we're seeing about a 2.3x, actually, so we got even more data since here, so about a 2.3x improvement from N-acetylcysteine. So overall, if you kind of put that together, it means we're getting arguably over a 20x improved kind of effect per given dose. More importantly, though, all the mechanism stuff is all cool and good, but do we actually do what we need to do, which is reduce lens stiffness? So what we did is basically treated with an eye drop 8-month-old mice for 1 month, similar to how we would do it in a patient. And we found that the median restoration of lens flexibility, and the way you measure that is by basically looking at how much the lens bends under load, is on average 68%. So that means, healthy mouse, 8-month-old mouse, about 68% median restoration. And this is something which we thought was pretty powerful because not only, that doesn't even necessarily mean 68% improvement of near vision. You have people who are right on the edge of, having near vision, 1 diopter from that versus, which could pretty easily come over the threshold for effectively, getting reversed from presbyopia with this type of significant lens stiffness reduction. So in mice, we had really strong results. And lastly, we have also shown that compared to another competing compound, which was previously being developed in clinical trials, which was after a phase 2A study acquired for $465 million by Novartis, later shown to be not quite efficacious enough, we have significant improvement in the same type of study, the study in 8-month-old mice. And we're also kind of following this up with some other assays, but it's a good indication that compared to some of the existing benchmarks, our compound is, got a leg up already. We also recently got positive human lens ex vivo data. It's not in this presentation, but I can tell you more about that if you're interested. So basically, we're currently doing multiple things simultaneously. A lot of it's focused on moving towards what we hope to be a clinical trial relatively soon, within 2 years. We're finalizing our actual eye drop setup in terms of manufacturing, and recently finished our preclinical formulation. And we are doing our toxicology studies and whatnot. So my team's in upstate New York, and also we have a number of academic collaborators, and we And then, yeah, lastly, we're fundraising right now. Raised about $1.7 million this round, open to any interested angel investors. If you're interested in hearing more about it, happy to talk. Yeah, I think you can thank ICOR and Kelsey Moody for that, the CRO and incubator that are there. So they were our initial partner when we started.
It sounded like this precipitous drop in glutathione around the age of 40 is what's driving presbyopia, or at least one of the factors. Maybe that was my understanding from what you were saying. So I'm curious, anyone tried supplementing glutathione? Does it not get into the eye, or is this?
Yeah, that's a very good question. So glutathione was one of the drugs we were testing initially. It actually did have a significant effect ex vivo, but is relatively minor compared to even N-acetylcysteine. I think that it's a little bit larger than some of these other protective thiols. So and in that sense, it's also going to be even harder to get across the cornea. Basically, I think it would, it could have some small level of benefit, but our drug is very much designed to be optimized for the types of difficulties, like pharmacokinetic difficulties, that you're likely to run in with an eye drop specifically.